Okay, today I have two guest speakers with me. I have Amanda Hare, and she is a speech and language pathologist. She works with Ramsey Therapy out of Stigler. And then I have Carlie Rose, and she's an occupational therapist with Total Rehab at McAllister. And so this is the first time for us to do this was suggested by the division chair this past week, that we do like a podcast section and talk about our chapters. So this week I've chosen two ladies to help me talk about our chapter, which is thinking, language, and intelligence for this week. So first of all, Amanda, if you'll go first, why don't you tell us what you do at Ramsey and kind of how the age that you mostly serve, and that you can go on beyond that, that you do work with home health, and then talk about some of the assessments that you do when they come to you and beyond.
Okay, I have been a speech pathologist. This is my 20th year. I worked at a public school for a long time, and now I do private outpatient therapy. And a lot of my kids now that I will get early on, a lot of times by 18 months, whenever they are not beginning to use words by their 12th birthday, we become a little bit concerned for that. And so it's been very, very good to see the progress when you can start earlier with those kids, because the primary time to target those skills are between birth to 3. And if you have a delayed child and they're not using words by 12 months, it's a time to get started with your therapy. And so that includes your language development, what they're able to understand, being able to follow a direction, being able to imitate sounds back to you or words, being able to point and label to things. Even as a little baby, they can do that early on. We can teach sign language to them before they begin to use words, which also promotes their language development. And if they are not using words by that age, it's a good time to start. However, if they're older, if you have an older child, let's say your child is 3 or 4, and they are beginning to use some words, but their speech is unintelligible, then it's a good time to start with some therapy for their articulation, or what we call sound development as well. So it's so important to sit and play with your little ones, be able to read to them, be able to communicate back and forth. It could be nonverbal, even before their first birthday. There's a lot of things that babies will do to communicate with you by just sign or gesture, waving bye-bye, pointing, cooing, babbling. All of that is important. Direct time that you spend with your child is very important also as an infant. Being able to sit and play, being able to point to things and tell them what they are. Talk to them through every little detail that you do, and that way you'll have kind of a head start on their language development too. I work with all ages from birth through adults. There is, I think research shows about 20% of children have a language delay. I feel like that in our area, in rural areas, it is much higher than that. When I was
Carlie and I would agree with that.
Yes, when I was at the school, we would have about a third of the grade in speech therapy, and that is, older. And research also shows that kids that have a speech or language delay have reading problems for the most part too. And if they are diagnosed early on with a major language delay or disorder, 80% of those kids never reach age appropriate reading levels. And so that's pretty significant too. I'm not sure what other questions that you have.
Well, okay.
I'm just going on.
About the reading. So talk about, I know that I've referred a couple of kids that were not good readers, and that indirectly you were able to help them with kind of I think the foundation. I know with my own children, they had Doreen Forrester as a first grade teacher. She taught phonics, and I thought that was an amazing thing for both of my kids to learn how to spell, to learn how to read well. And then going on. And like you're saying, if you don't have that core foundation, then you can struggle, later on. Talk about some of your older clients who may have had a stroke and how they lose some of those things, and then you have to kind of pick it up, and then we'll jump to Carlie.
Oh, absolutely. Absolutely. There's a variety of factors for that. They could have a traumatic brain injury. They could have had a 4-wheeler wreck or a car wreck, and have damage to the brain. Same thing with a stroke. If there's any damage to the brain, then your cognition and your language and your memory development are all affected by that. And so what happens is they have to totally relearn how to use words and understand directions and concepts. It's hard for them to understand someone on the phone or to express information back to somebody on the phone. Just to learn to eat and swallow. That's another area that we work on, because when you have a brain injury, your brain affects that also. So you have a question?
So for those that have that want to go on and maybe pursue a vocation in speech pathology, did you ever do a rotation in a hospital? Did you do a rotation in a nursing home? Did you do a rotation for your internship in some of those other places besides a school? Because when you think about language development, okay,
we were required to do at least 8 weeks in a healthcare facility. So I did a rotation at McAllister at the hospital, and I did 8 weeks there. Part of my time was down in the rehab, and part of it was on the skilled nursing floor. And so, of course, we got to deal with brain injury in all areas, as far as stroke, dementia, Alzheimer's, accidents. And so the level of functioning was different for, whatever the injury was. And the prognosis is also different for depending on their age or their the damage to the brain.
And then probably talk about a little bit about the help that they might receive after they go home from a therapy session, and maybe the homework that you might assign, and what a caregiver or a parent, how important that is at home to
for sure. Depending on for both children and adults, it is so important to carry over what you learn in your lessons, whether you have your therapy once a week or twice a week or 3 times a week. It's so important to carry those lessons over so you can generalize them in settings outside of the therapy room. And that way that you can,
for real life.
Sure.
Yeah, right.
Sure.
Okay. I'm going to pause you for a second. I'm going to turn to Carlie. Carlie, talk a little bit about some of the things that you see age-wise, what you do.
Okay, I'm an occupational therapist, and I work for Total Rehab in McAllister, and I really see a wide range of populations. So I kind of go through each one. I work in the schools. We contract with schools. So we have a total of 46 schools covering most of this rural area. So I see kids in school through pre-K through high school. We don't have many kids in high school. It's mostly the younger kiddos. And then I work in the outpatient clinic, and there I see across the lifespan from, like Amanda was saying, below 12 months all the way up to, I see adults in the outpatient clinic as well. And then I also see home health patients. So this is the older population, people who are not able to leave their home. So I'll go through schools first. In the schools, what we address mostly is, so as occupational therapists, what we address is occupation. So that's anything that you do throughout your day that has meaning to you. So that looks different for every person. So everybody has occupations. It can be reading, it can be dressing, it can be brushing your teeth, brushing your hair. It could be just things that you enjoy, driving, anything that you do during your day that has meaning. In the school setting, we have to address things that are educational and how it affects your education. So kids who are struggling in the classroom, and we address fine motor skills and also a lot of sensory processing, kids who are having difficulty just functioning in the classroom overall, and we address those things. So with our little kiddos, it's being able to write their name, hold a pencil, scissor skills, being able to tie your shoes, those kinds of things. As it gets up into the older kids, a lot of kids still have difficulty with fine motor skills and struggle with just handwriting in general. So we work on that, and it's just some one-on-one time. And we usually see kids for 30 minutes in the school system, and they get pulled out. And there's a kind of a fine line on being pulled out in the class, out of your classroom to work on these skills rather than staying in the classroom. But I see a lot of times in the rural areas, there's so many kids in a classroom and there's only one teacher. And it's just these kids that do have deficits or do have difficulty, they just kind of get pushed to the side. So that's where, like for PT, OT, and speech in the school, pulling these kids out and working with them one-on-one just gives them that additional help. We also address sensory processing disorders or kids who have difficulty with sensory stuff, if you guys aren't familiar with that. So everybody has all these inputs coming in throughout the day. It's, sound, noise, light, vestibular input, movement, all these things. And if you aren't able to regulate your sensory system, then it can cause difficulty just functioning in everyday life. Some of us just have sensory difficulties, like we might tap our pencil or shake our leg or, twitch, have your little thing that just helps you focus. And kids who have like a sensory processing disorder, they aren't able to regulate their sensory system. And we see this come out in like poor behaviors, and they're acting out in the classroom or they're throwing themselves into the floor, things like that. So that's kind of the school system. The outpatient clinic, my kiddos, I address kind of the same thing. We do address fine motor skills, but in the outpatient, we can address like a wider range of things. We do adaptive behaviors, which entails like being able to get dressed. So we have kiddos coming in, and they aren't able to put on a shirt. They aren't able to put on pants. They aren't able to put their shoes and socks on. And then as you get older, kids who aren't able to tie their shoes, we work on all those things. Social emotional skills, being able to regulate your emotions and interacting with other kids, being able to take turns and how to act appropriately. Let's see what else. Fine motor skills, same thing. Scissor skills, handwriting, just fine motor skills in general. And as you get older, that translates to being able to feed yourself, more intrinsic things. My adults in the clinic are more like have balance issues or upper extremity injuries like rotator cuff, or they had some kind of hand surgery and they need therapy on that. We do hand therapy with strengthening if they've had a surgery, and that's affecting them. Like Amanda was saying, it changes their whole world and they aren't able to eat the same. They aren't able to drive or write, those kinds of things we work on. Home health. So home health is you're homebound, you can't leave your home. And same thing, it's kind of a range of disabilities we see. Could just be old age and just decreased strength overall and weakness, and we're having falls. And so we do home modifications, going in their home and seeing what changes can we make to their home to make it more safe for them and more functional. We do strengthening exercises. We, like if someone's had a stroke and now they aren't able to use the right side at all, we're going to have to teach them, different ways to get dressed, different ways to feed themselves. And with the stroke, sometimes that movement comes back and sometimes it doesn't. So as OTs, we have to really think about, is this going to be a modification for the time being, or are we going to have to completely change how they do everything because they might not ever get that movement back. So we do that.
Okay, so so talking about what Amanda does and what you do, it's kind of like you guys, your therapies are both kind of married together, and you guys can work as a team. Like she was saying, hospital setting, somebody may have to relearn how to swallow, get dressed, brush their hair, brush their teeth, those things.
And I would say, especially in my clinic, I see, Amanda, I don't know about you, most of my kiddos who are like, if they're developmentally delayed or they have, autism or ADHD or sensory processing, a lot of my kids also have speech as well. A lot of my kids have OT and speech.
That's what I wondered.
Yeah.
Yeah.
Yes, for sure. Actually, that percentage is probably very high.
Yeah, I would say my kids probably 75-80% of my kids have both, maybe more.
Okay.
That's just off the top of my head.
Have both services.
Yeah.
Okay.
And I add to what Amanda had said, early intervention is just so important. About right now, I'm seeing in the school system kids in kindergarten who just, some kids have diagnosis, yes, and some is, I think, lack of exposure of they've never held a pencil, they've never held a crayon, they've never touched scissors, and we're in kindergarten or pre-K, and I go in and evaluate them and their scoring. I do an assessment, and based off their age, we see if they're scoring average, below average, poor, or very poor. And so many of these kids are scoring so poor in that poor range of they just do not have the skills just starting school, and then it just starts them behind. And then, it's just kind of takes a lot to get them caught up to where they need to be. And same thing in the clinic. I think early intervention is so important. And I don't know, this is just a comment, Amanda, you might add to. I don't know if you've seen this. Recently, I've seen a lot of kids come in at a later age. I don't know if it's lack of education or lack of exposure of what, like me and Amanda do, and people aren't educated on what all services we provide and how we can help. But I'm seeing a lot of kids come in older, like 10, 11, 12, and they've never had any kind of therapy in their life and could have benefited from it since they were birth or, 1 or 2. And just like knowing, like, if I would have seen this kid when they were 1 or 2, the changes, like where they would be at versus where they are now. And it's just really sad. And I feel like as a professional, that's part of my job too, is educating, like you guys, college students or people out there, that I know in my profession, there's not very many OTs, especially in this area. And just, I feel like just getting the exposure out there of what we do and how big of a difference we can make.
And talk about your caseload. Like what would you say?
Go ahead, Amanda.
Okay. Yeah. Go ahead. Sorry. Can't hear you. Can't hear you.
Can you hear me?
Yeah.
Yeah.
Now you can.
Okay. I feel like, sorry, I'm on my phone. I feel like, especially in rural areas, people just do not. Hear me now?
Now you
Can you
can.
hear now? People just do not know the availability of services, especially if you have sooner care. The services are free if you qualify. And so any child that receives sooner care could have free therapy services, depending on their amount of delay that they have. And so there's really no reason to not take advantage of those, as a financial burden, because they're available. And so depending on what town that you live in, the school can start providing services to your child at 3 years of age. And I don't think that everybody knows that either. They do not have to be attending kindergarten yet to receive those extra services. So if you feel like they might qualify and they're 3 years old, then the school could provide that free of charge for you. If they are younger than 3 and you have concerns, then an outpatient service like us, or a program called Sooner Start, which is available through the state. And you could go to your local health department and they could help you get set up with that service. And that is a birth to 3 program, which is also free, and it's provided by the state. And so that your child can receive Sooner Start services and outpatient services like Carlie and I do at the same time, and there's no conflict of interest in that. Your child can also receive services within your public school system and outpatient services, and there's no conflict of that either. And so there are so much available resources to people. They just don't know about them, I feel like.
Yeah.
And so maybe this will help you guys be able to understand kind of things that are available to you Or if you know someone that has a delay, maybe you could kind of forward that information to them.
Okay. Talk about your assessment process. If, say that I had a 5-year-old and I didn't feel like verbally they were where they needed to be. If I brought them to you, how long is that process? Like, what would be an initial intake for speech therapy and occupational therapy?
I do a free screening, and so I can do it in 5 minutes. So if you are concerned at all about what level that they're on, I can do a screening in about 5 minutes. I don't charge for that. Just make an appointment and I can do a fast little screening. If your child at that point will qualify, then for outpatient services, then you will need to make a doctor's appointment with their local doctor, and their doctor will give them a referral to the outpatient clinic that they want to go to. From that point, when your insurance provides or approves that evaluation, then we can do the evaluation. We send a copy of that report back to the insurance company, and we ask for so many sessions. And the way Sooner Care does it is they do ours is they provide 4 months worth of services at a time. And so you can ask for different amount. Carlie, do you guys do 6 months?
Yeah, we do 6 months.
Okay, we do 4 months at our clinic. And so every 4 months we ask for more sessions depending on the progress of the child. And so depending on how fast your doctor's office gets your referral sent in and how quickly that your insurance will approve, those factors will kind of determine how quickly it can get done. Personally, I can get it done fast, but a lot of times we have to wait on insurance, which inhibits that process a little bit. But for sure within a month, even going through all the steps.
Oh yeah.
Start within a month.
Okay. Do you do private insurance as well?
Yes. Private pay, private insurance.
You do too? Okay.
Mm-hmm.
Okay. Assessment for you.
So in the school system, how it works is we can do screenings in the school system, but either a teacher or a special ed director refers a kid. And so they send that to our main office, our school office, that they want an OT referral. And then I go in as the evaluating therapist and complete the evaluation on my school kiddos in 15, 20, 30 minutes tops. I talk to their teacher, or if they're in a special ed classroom, and then I determine services based off of that. So school services are different depending on the school. So how ours works is I contract for the school, but the school system legally, if a kid is on an IEP, they have to pay for services for that kid.
IEP, individual education plan.
Yeah.
Okay.
So a kid that there's kids that are on IEPs, and that's just modifications that they need to help them succeed in the school system. Some kids have speech, some are on speech IEPs or speech only. Some have speech, OT, PT, different things like that. So then we do the evaluation and we see them. Some kids I see 2 times a month for 30 minutes, and some kids I see 4 times a month for 30 minutes. The occupational therapy assistants are the ones who see them in the school system. The school pays for that. Some bill Medicaid, some don't. That just depends on the school system. But so for parents too, like if you feel like your kid needs OT or speech or PT in the school system, you can go talk to the special ed teacher and request that, and then they send us the referral for that. Some schools have a speech therapist at the school, like Amanda. She used to work for the school system and she was there full time in some contract. Most schools don't have OTs like in the school system. Most of them contract out for OT and PT services. Outpatient clinic for kids, same thing, Amanda. We have to have a script from your doctor. With OT, you go to the doctor, get the script, and I can complete the evaluation right then. I don't have to have approval to complete my evaluation. I complete my evaluation, and like she said, request for a certain number of sessions, and then insurance approves that or denies it. Or, if I ask for 25 visits, then they might say you get 15. and you determine how you want to spread those out over a period of time. I do reevaluations every 6 months and then annual evaluations every year for kids in the clinic. OT, as far as my evaluations go in the clinic, a lot of it is conversation and interview type occupational profile, as I call it, with the parent, just seeing what problems we're having or what concerns we have. I do 2 tests that are questionnaire type of what the kid can do from what the parent says if they're, younger and they can't answer those questions themselves. Then I do a formal fine motor assessment and then a couple other tests, just depending on their diagnosis. For adults, same, it's different. You have to have a script from your doctor, but most of the time with my adults, my script from my doctor has what they want, like 3 times a week for 6 weeks is what they want services to be. Home health is a whole nother monster. Same thing, contract with home health companies who they deal with the insurance side of things. So a home health company contacts us and says, we have a patient who needs to be evaluated for OT. So either they already have determined a set number of visits of what they're going to allow us to have. And I know that going into the evaluation, so I can kind of see what the patient needs and kind of decide how that's going to be spaced out based off that. Most of the time, go in, do the evaluation, and then send it to the home health company of what I want. And then they come back with what they decided based off the insurance, and we go from there. Home health assessments, I do manual muscle testing, range of motion. I kind of get to see everything. They're in their home. So just we kind of go through what they can and can't do and really what they want to be able to do and what they're having difficulty with. And then, like I said, we work hand in hand with the home health company. So there's all kinds of different home health companies and we contract with a bunch of them. So it's different for every home health company, and it's also different based on their insurance, but it's kind of a process because we have to be in contact with the home health company who has to be in contact with the insurance, and then they get back with us. And then, sometimes it's
Red tape.
It's most of the time I can see a home health evaluation and the next week we're doing treatments, but we're running into it's a couple weeks maybe out. And that for some of those people, especially if they've had surgery, they want to be seen ASAP, but that's kind of the process I go through.
And I know that both of you are able to bill for telehealth sessions now, thanks to COVID. And so I know that has helped to kind of reach some of those people that would normally, not be able to come in to an office setting or something like that. Okay, great information. One last thing that I want to talk about is the intelligence part. We talked about a little bit with people who are developmentally delayed. I know in psychological testing, sometimes when I get those reports back and I have a child that has an IQ of 70 or below, one of the recommendations from the child psychologist that I use typically is, I would like to see this child do speech. I would like to see this child do occupational therapy. I would like to see this child. Those recommendations come from there. Do you guys see a lot of, and this may be a redundant question, do you see a lot of developmentally delayed where their IQ is really, really, really low? And is that child or is that person on your caseload for a very, very long time? Do you just keep recertifying them? So Amanda, if you want to answer that.
Typically, yes, we have a lot. A large percentage of my caseload are I shouldn't just say kids because adults too have a lower IQ, and you do serve those people more longer term than someone with a higher IQ, just because their ability to learn information is slower than someone with a higher IQ. And so most of the time, those developmentally delayed children, in my case, have so many other issues, not just a speech delay, that their whole life is affected by the other delays that they have as well. And so those kids or adults can receive services for a long time because they can continue to learn. Their progress is just slower.
Yeah, I would agree. I think, like Amanda said, I have a lot of kids that have been on my caseload or stay on my caseload for a while. And like she said, they are able to learn just at a slower pace. And also, as the life and world around them changes, they don't necessarily adapt to the changes, I feel like. And as they change to a new school, or it's kind of like 2 steps forward, 1 step back, kind of a pattern that we go through. And just kind of at how everything changes, then we have to learn new things or continue to learn things as things around them change. But yeah, I would agree.
Okay.
And like she said, that most of those kids, there's a lot, we're having difficulty getting dressed still, we're still having difficulty going to the bathroom by ourselves. And it's just kind of a longer process.
Okay. Okay, I think that wraps it up, unless either one of you have a closing, something that you want to say. I can't thank you enough for joining tonight. I'm going to upload this to Blackboard just as soon as I can get really fast Wi-Fi, and maybe I can do that here. So this will be ready for you at 8 a.m. in the morning, and I appreciate you. Thank you, Amanda, for talking, and Carlie, thank you for letting me use your home tonight. And I just appreciate your attention.
And
Thank
I'll
you.
give Stephanie my contact information.
Yep,
I
that'd be
always love to promote occupational therapy. If anybody, is in school and doesn't know what they want to do yet, I'm always happy to answer questions about the process and what all I do in more
That'd be good.
detail.
And I can get you in contact with Amanda too, if there's somebody that wants to do speech therapy
Sure.
and language. And then, okay, I have a question. You have somebody that works under you,
Uh,
and do you have somebody that works under you to do?
No,
Okay,
no, I do all of my own.
Yeah. So
but could somebody work under you for?
There is something called a speech assistant.
Okay,
There are not many of those in Oklahoma, though. It's not very.
okay,
It is available, and there are some, but they're not very common. And so the speech therapist does our own evaluations and all of our treatment ourselves. So once I get you, you're mine the whole time.
well, you probably have to sign off on those things for it to be approved too, as well, and for your billing and.
Yes, yeah.
and
I'm just like,
go ahead.
and I'm just like Carlie. I'm always available for questions. I never mind someone ever asking me questions, because I'm like Carlie. I love what I do. I've done, like I said, this is my 20th year. I love every part of my job. And so if I can help somebody, I would be glad to do that in any area.
So I'm occupational therapist, so I'm the evaluating therapist, and we have occupational therapy assistants. So I do the evaluations and I can do treatments as well. But my occupational therapy assistants, they just do treatment. So they don't do any type of testing, evaluations, anything like that. So I write my plan of care, my treatment plans, and then they treat kids based off of that. So like I was saying, in the school system, like I only do evaluations and my reevaluations, and then the occupational therapy assistants do the treatments. In the clinic, same thing, they do treatments. I do some treatments, or I used to. Now I don't have enough time to do any treatments. I solely do evaluations, and same thing for home health. I just go in and do the evaluation, and then I have one occupational therapy assistant that just does home health treatments for me. It's a little bit different as far as speech. OT and PT we have evaluating therapists and assistants, and then speech is just the speech therapists that do their whole thing.
Okay. Okay, well, thank you both so much for doing this with such late notice. I can't apologize enough, but thank you, and I'll get this uploaded.
Thanks.
Bye.
Bye, thank you.